Welcome, everybody, to Community Q&A with the Herald and News. My name is Steve Rosen, joined today by Dr. Jill Fay from Sage Women's Imaging and Specialty Ultrasound. Welcome, Jill.
Thank you.
We appreciate you being here today. An enormous amount of training must have gone in to get you to where you are today, given the services and materials you use to provide those services.
So yeah, every radiologist goes through about 14 years of training.
Wow.
That includes college and medical school and residency training. But I did additional time specializing in breast imaging and ultrasound. And that focused on mammography, including 3D mammography and breast MRI, and also breast ultrasound and ultrasounds of all parts of the body.
So not only an MD, but a professional student as well.
Yes, it took a long time to get here.
It sounds like it. Now, the percentages of people, women and men out there who face breast cancer, it's kind of scary, isn't it?
It is scary. The current statistics suggest that 1 in 8 women will be diagnosed with breast cancer in her lifetime, and 8 out of 9 women diagnosed with breast cancer have no known family history. Men are in the minority, but there are a significant number of men as well, especially if there is a family history.
But a test is a test. I mean, everybody just goes in and test, and then you wait forever, and then you get the results. But that's a little different from what you do, correct?
Yeah, so especially in terms of the mammography portion. So a screening mammography is a yearly exam that's performed when a patient has no symptoms, and her doctor and she or he feel no abnormalities on exam. This is a standard set of views. Diagnostic mammography includes additional views and often breast ultrasound targeting the area of concern. And it's very important to know what's going on with a patient to do the correct exam for them.
And men too?
Yeah, so men are in a minority for breast cancer, but it definitely happens. And especially if there's a family history in the women in the family.
Nice.
Typically, men don't have screening mammography. But definitely if they feel a lump or another abnormality, they could have mammography. That would be recommended. And also if there's a family history, risk assessments are recommended because they could be at increased risk as well.
But the waiting is the hardest part, isn't it? I mean, you go in, you take the test, and then you're like, how long does it take to get results?
So at our clinic, we offer results at the time of imaging, and patients can ask to speak with me about them. Often, if additional imaging is needed, such as diagnostic mammography or breast ultrasound, we can get them in the same day. And we're trying to decrease waiting time and worry time.
That's so important for people, isn't it? Because it's a lot of it's, I mean, obviously they have a physical challenge, but a lot of it is also mental, isn't it?
It's a very stressful process just going through the breast imaging. I think it's partly a sensitive area that we're not exactly comfortable showing or being examined, but also just how prevalent breast cancer is. It causes a lot of concern for people.
Sure. And your facility is at?
We're Sage Women's Imaging and Specialty Ultrasound at 2613 Almond Street.
Okay. And if people want to call you to make an appointment?
It's 541-851-9395. And women can present for screening mammography without an order from a doctor. Or we're happy to contact your doctor's office if you need an order.
Dr. Jill Fay from Sage Women's Imaging and Specialty Ultrasound, thank you so much for joining us today.
Thank you for having me.
Thank you for watching the Community Q&A with the Herald and News. My name is Steve Rosen. We'll see you next time.